Hello and welcome to this Foster Care Institute online training webinar. Anger Management, How to Care for a Teen with Anger Challenges. I am your host, Dr. John DeGarmo, founder and director of the Foster Care Institute. I'm an author of several best-selling foster care books, international speaker and trainer, and I have been a foster and adoptive parent as well. Indeed, over the years, my wife and I have had over 60 plus children join our family and join our home, placed from foster care. In our home, there's no label, there's no biological or adoptive or foster child. They're all our children, and we love each of them. To be sure, we've had many teens in our home who have had issues with anger management, and we've experienced it firsthand. Our goal during this webinar is to increase your awareness of what teens in the foster care system, why they might have anger behavior challenges, and how to best address those challenges. Our key objectives are to increase your awareness of why teens in the foster care system might experience anger, and we're going to help you get some strategies, develop some strategies and tips on how to help teens with anger management challenges, teens that you work with. To be sure, as we've covered here at the Foster Care Institute several times, children and teens in foster care often have issues of anger management for a number of reasons. But what causes anger in teens? Why are the teens placed in foster care, the teens that you work with, the teens that reside at the home that you're at, why might they have issues of anger? Well, let's examine some of those reasons. Now, the first is stress. As we know, stress can play a very, very important factor in the lives of today's teens. Now, as I've mentioned to several journalists, we are experiencing a time of mental health issues for our teens. Today's teens are filled with so much more stress and anxiety for a number of reasons than perhaps teens of other generations. Now, this stress, the stress that they are experiencing, the stress that they are filled with, can lead to bouts of, we're going to call them tantrums for this webinar, can lead to bouts of tantrums as well as displays of anger. Now, for youth in the foster care system, there are so many anxieties that are placed upon them, filled with so many anxieties that they really struggle with on a day-to-day basis. The anxieties of school as they move from one placement to the next and one school to the next. School can be a time of tremendous stress for teens and youth in the foster care system. As noted in the book, Helping Foster Children in School, teens in the foster care system are generally 18 months behind academically, and they struggle with reading and math skills. So as they go from school to school, and they fall further and further behind with their academics, this can cause a great deal of stress. There is a stress of visitations, or perhaps not having a visitation because the parents, the birth family, did not come. There's a stress, of course, of court. Court can be stressful for anybody who attends it. For those children and teens in the foster care system, it's a different level of anxiety. There can be the stress of having to go to professional therapy or counseling services and professional therapy sessions that perhaps the teens do not wish to attend because they feel that they do not have to do so. They feel that there's no problem. And then there is the stress of their own personal situation. The personal situation of why they might have been placed in foster care, and the personal situation of being placed into a facility or a residential home that they do not want to be in. Remember, it's important for us to remember here, no teen wants to be in the foster care system. They did not ask to be placed in foster care. They did not ask to be placed in the home that you work at. So this can add additional stress. So the stress of school, the stress of visitations, the stress of court, the stress of professional therapy and counseling services, their own personal situation. All of this can result in displays of anger. It can result in the teen lashing out at his fellow teens, lashing out at the other staff members, lashing out at school employees and teachers, lashing out at a caseworker, lashing out at a professional therapist or counselor, lashing out at you. There is abuse. Many youth in the foster care system have suffered from some sort of abuse. And this abuse might lead them to, yes, lash out in displays of anger. Because when they do so, this could be a release from their pain. They are filled with so much pain from the abuse that they have experienced that lashing out or having that tantrum, so to speak, could be, again, a release from their pain that they're filled with. Another reason for their anger might be neglect and trauma. Indeed, many youth are placed in the foster care system because of neglect, as the teen suffers from neglect, and they've suffered from their own personal trauma. Many of these teens might struggle. They might struggle with their feelings. They might struggle with their anxieties, as quite simply they do not feel safe. They do not feel safe from harm. They do not feel safe from additional neglect. They do not feel safe from additional trauma. They do not feel safe from additional abuse. They may not feel safe in the environment that they're now currently living in with you, where you are at, where you are working. This trauma, these anxieties, these feelings can lead to anger. Oddly enough, some teens might become angry in an attempt simply to get your attention. You see, they crave the attention of an adult. These teens want your attention. And they might feel they have to get that attention by displays of anger. They have this anger issue in order to get your attention, even if it is negative attention. They might have that outburst, they may have that tantrum, they may have that meltdown trying to get your attention. Some teens might have tremendous issues of anxiety and great difficulty in processing and understanding the sensory information from where they live, their environment, their surroundings. This can lead to outbursts. This can lead to emotional meltdowns. Attention deficit hyperactivity disorder, ADHD, is something that many youth in the foster care system struggle with. Indeed, many youth with ADHD, especially those who are hypersensitive or those who are impulsive, well, they have trouble controlling their behavior. Those teens that have ADHD may have difficulty following directions. They may have difficulty transferring from one activity to another. And as a result, these teens with ADHD, they may appear angry. They may appear frustrated. They may be defiant towards you and towards others. We have a whole webinar on ADHD here at the Foster Care Institute, and I encourage you to view it to find out more information about this. Autism in a teenager just might trigger an emotional meltdown. It might trigger an anger issue because lack of consistency, again, bouncing from environment to environment, from home to home, from school to school. Lack of consistency, lack of structure, lack of routine, and the unexpected might cause this teenager to feel unsafe. And those teenagers who feel unsafe and who have autism, well, they might be overwhelmed from their personal situation and may lash out. Again, we have a whole webinar here on autism at the Foster Care Institute as well, and I encourage you to check that one out. As we know, many teens in the foster care system are at least 18 months behind academically, and they struggle with reading and math skills. And as they go from school to school, they fall further and further behind. Perhaps this is one of the reasons why 55% of youth in the foster care system will drop out of school when they age out or transition out of the system. For those teens who have undiagnosed learning problems, they will struggle in school. They will struggle in the classroom. They will struggle with learning. And as they move from school to school, well, this might trigger even more anger and even more frustrations. So as they struggle in the classroom, as they struggle with their school, as they struggle with their education, well, they might release their frustrations, their stress, their anxiety in the form of anger. As we know, so many teens quite simply do not have a positive role model in their life. Sadly, far too many youth in the foster care system have had poor role models their entire life. They've never had a positive role model at any time in their life. Their older siblings, their relatives, and maybe even their parents may have had anger management problems as well. So this is their role model. So they often mimic what they might see and what they are taught. They are taught anger challenges. They are taught meltdowns. They are taught hostility and defiance by those in their life, their role models. And finally, some teens might have issues of anger management because they're trying to fight back. They're trying to get back, if you will, at somebody in their life. Somebody who may have picked on them, somebody who may have bullied them, or somebody who may have hurt them in some way. So this display of anger is a way, if you will, at trying to get back or fight back at that individual. For those of us who work with teens in the foster care system, it is generally an exhausting job. Very rewarding to be sure, but it can also be very demanding. When it comes to working with teenagers who have anger management issues and anger management challenges, this can be even more exhausting. In fact, you might simply be frustrated in the situation, frustrated that the teens that you're working with are always angry, who are always defiant towards you, refuse to comply. You might be confused as to why they're doing so. You might be confused as to how to best address it. But make no mistake, working with teens who have anger management challenges can be exhausting, frustrating, and confusing. So, how do we help? What do we do when we're trying to help a teen who has issues of anger? Well, for those teens that already have an issue of trust and attachment, how you address that teen who has anger management challenges, well, this can be difficult. How you address them can be very, very tricky, if you will. Now, let's look at what you should not do. You should not do this. Harsh punishment, harsh consequences might be something that might alienate the teen from you or push the teen even further away from you, from staff members, from caretakers, from other teens, from others. So no harsh punishments, no harsh consequences. Lectures and debates, that's not going to help. Save those for another time. That'd be much more beneficial. That teenager who's having that anger meltdown, who's being defiant, He does not need a lecture or debate from you. In fact, that's not going to be helpful at all. Finally, many teens in the foster care system have never had a moral upbringing or have had a very different value system than you do. So if you're trying to lecture them or talk to them about morals or values, keep this in mind. It very well may not help because they do not have an understanding because they've not experienced what you have experienced. So, no harsh consequences, no harsh punishments, no lectures, no debates. So, what should you do when you're working with a teenager who does have that anger challenge? What should you do? Well, to begin with, and we've noted this here several times in the foster care institute, do not take their behavior personally. Yes, that teenager might be yelling at you, but but that's what he's doing. He's yelling at you. He is directing his anger towards you. You happen to be in the way. It has nothing to do with you. It has everything to do with the fact that he is filled with stress. He is filled with anxiety. He might be suffering from tremendous neglect and abuse. He might be suffering from ADHD or autism. He is simply lashing out, and you happen to be in the way. So remember this. The next time that teacher refuses to comply, the next time that teacher is openly defiant towards you, the next time that teenager is yelling at you, cursing at you, threatening you, accusing you of something, remember this. Do not take that behavior personally. Again, has zero to do with you, has everything to do with how that teenager is feeling and how he's trying to express himself and understand and manage his emotions. Emotions that are overwhelming him, emotions that might be in conflict, emotions he might not understand, emotions he does not know how to best address. He is struggling to survive. So when he is yelling at you, avoid yelling back. Do not yell back. Do not be aggressive towards him. As you most likely know, yelling back will not help in any way. In fact, it's only going to increase the problem. So instead, try to lower the tone of your voice, lower the intensity of your voice, and try to discuss the problem calmly. Now, he might have always been yelled at before coming to live in the residence, coming to live at the home. In fact, that might be his norm. Remember, he may have had poor role models who always yelled at him. So he's just doing what he's been taught. So how you respond is important. Calmly, politely, lower voice, lower the intensity, and do not respond back in an angry or aggressive or loud fashion. It will not help. Now, to be honest, we all become frustrated at times. As we noted, working with youth who have anger management challenges can be frustrating. So, if you should become frustrated, or when you become frustrated, or maybe even angry yourself, you lose control of the situation. Do not do this. Instead, let the youth know that you are in control of the situation and that you know what's best for him. When you do so in a calm fashion, this will help to de escalate the situation and keep everybody safe from harm. So don't lose your don't lose your patience. Remain calm and let him know that you are in control of the situation and you know what's best for him. If for some reason you do feel overly frustrated and you feel like you're losing control and you can feel your frustration, your own anger rising, it might be It might be wise to step away from the problem. It might be wise to call a time out, if you will. It might be wise to ask a fellow staff member or a supervisor to step in while you step away from the problem for a short time to try to recollect yourself, to try to bring calm, to try to lower your own anger and frustration. It's okay to have that time out. Remember, you are human as well. It is okay to become frustrated. It's okay to become angry. Simply do not show that frustration or show that anger towards a youth when he is feeling the same way towards you, because it only helps to increase the problem. When it comes to discipline, we need to have this reminder: at any time, you are never allowed to use corporal punishment. Let me rephrase that. There is no time you are allowed to use any form of corporal punishment. Quite simply, you are never allowed to use any form of corporal punishment on a teen. In addition, do not threaten this type of discipline. Even the suggestion of using some form of corporal punishment, that can place you at risk. That can place you at risk of an allegation or an accusation. It can place your own job and career at risk as well. So, do not use corporal punishment and never threaten this type of discipline to the team. When the teenager that you are working with is having that meltdown, when he is screaming, when he is yelling, when he is showing hostility, when he's having a tantrum, so to speak, take a moment to think about why he is doing this. What is behind this action? Remember, it has nothing to do with you. There's a reason for it. Is his meltdown or tantrum, so to speak, is it related to some sort of learning disability or learning disorder? Is it a sensory related problem? Does he have a history of abuse before being placed into the home? Does he want your attention? Remember, he might be yelling and screaming at you and showing hostility in an attempt to get your attention. What might the reason be? That is what you need to ask in the moment. Why is he acting this way? What might have triggered it? What in his past might be leading to this very moment? After you have thought about and considered why he might be acting this way, after you've taken some time to examine why he might be angry, remind the teen that you care for him, that he is loved, and that you are there for him. Remember, he may never have heard these words of comfort. He may never have heard the words that someone cares for him. He may have never heard the words that he is loved before in his life. There's a very good chance that he's not heard those words, or he's not heard those words enough lately. So again, remind him that he is cared for, that he is loved, that he is important, that he is special and unique, that you are grateful for him, and that you are there for him. Remember, these might be very strange words to hear from him, but for him. But he needs to hear these words from you. If he doesn't hear them from you, there's a very good chance he might never hear them at all. Now, this could be difficult, ignoring the behavior. As difficult as it might seem, and as mean as it might seem, sometimes ignoring his behavior is the best form of management, anger management. You need to let the teenager know that you will not be affected or impacted by his behavior. When you ignore his tantrum or you ignore his outburst, well, this can prevent it from growing into something bigger. As you ignore it, After time has passed and you have ignored it, well, his anger and his outbursts, they will decrease. Now, it is important that when you are ignoring his behavior, you also need to ensure that he is safe. Safety is a priority. When he's having that meltdown, when he's having that tantrum, when he's lashing out, and you're not taking it personally and you might be ignoring it, just keep an eye on him to ensure that he is safe. Safe from harm, or everybody else around him is safe from some of his actions as well. That he is not hurting himself or hurting others. Safety is a priority. He needs to feel safe. Remember, he might be triggered by noises. He might be triggered by the nighttime, darkness, or other ways that you quite simply might not expect. Sounds, music, a song, foods, memories, whatever it might be. And this could lead to a meltdown. So you need to remind him that he is safe all the time. If there is a thunderstorm, pop into his room and let him know that he's okay. If he had a hard day at school, or perhaps he is working someplace, and he comes home and you can see he's on the edge, remind him that he is safe there. You need to remind him on a day-to-day basis that he is safe. When he feels safe, this will go a long ways in helping him learn how to trust and form a healthy attachment. There may be those moments when you quite simply want to give in. You want to give in to him because you are tired, if you will, or worn out or weary from his meltdown. When he is having that meltdown, when he is having that tantrum, when he might be yelling at you, do not give in. Do not give in to him. If you do so, if you do give in to him, well, then he is going to expect you to give in to him the next time, and time and time and time again after that as well. You're setting a precedent when you do give in to him. So do not give in. In addition, he will know the only way to get your attention is with this type of action if you do give in. So stand firm. Remind him there are better ways to obtain what he wants. There are better ways to handle his emotions. There are better ways to get your attention. Professional therapists, professional counselors, those trained professionals have a wide range of resources and tools that can help them as they help treat those who suffer with what might be ailing them, whatever fashion they might be. So, with that in mind, it is okay to have a professional therapist or a counselor work with a team. You are not the expert in everything. I am not the expert in everything. There are trained professionals who are experts in this way. So seek professional help if you think that would be helpful. Talk to the caseworker. Talk to your supervisor about trained professional therapy or professional counseling services to help the teen better understand his anger and how he can best help himself during those challenging and troubling times. Help him understand what has happened in his life and how to overcome the negative beliefs he might have about himself. Remember, he might have a history of neglect, a history of abuse. He might have been abandoned. When we understand what has happened in his life, we can better address it. We need to help him understand what's happened in his life and how he can overcome any sort of negative belief he might have. Remember those poor role models in his life we discussed earlier? Those people who never had anything positive to say about him? There is a good chance that he might have grown up in an environment where there was a great deal of verbal abuse, where he was constantly belittled, constantly criticized, constantly yelled at, constantly put down, never told how important he is, never told how loved he is, never told how cared for he is. So he might have many, many negative beliefs about himself. You need to help him overcome those beliefs. Let him talk to you and listen as he shares his concerns. Listen as he shares his pain. If he does want to talk to you, put the phone down, turn the computer off, stop the cooking, stop the laundry folding, stop what you are doing, and give him your undivided attention. If you are distracted with a phone, with paperwork, whatever it might be, while he's trying to talk to you, if you're distracted and do not give him your attention, very likely he will not come back again. He will not come back again because he recognizes he cannot trust you to share his pain with. So be there to listen. Do not be overreactive. Do not be critical. Do not say things like, I can't believe you said that. I can't believe you did that. I can't believe you're yelling again. You do not overreact. Instead, you listen. You nurture and comfort him in an appropriate manner and appropriate fashion. Ask your supervisor or check your policy and procedure manual about what that might be at your facility. Consistency and structure goes a long ways as well with helping those teens who have anger management issues. So try to provide consistent structure each day when it comes to meals, chores, homework, playtime. At the same time, be flexible when needed. Learn how to be flexible when it comes to perhaps a birthday party or a movie or a special event. But remember this, structure and consistency can go a long ways in helping a teenager feel safe and thus help him control his anger. We talked a little bit earlier about how the teen might have never had words of encouragement or words of praise. Those need to come from you every single day. Look for ways, look for opportunities to praise and encourage a teenager every day at all times. You might say something like this, wow, your room looks so amazing, so clean. Thank you so much for keeping it clean. Can you show me how you do that? Wow, I am so grateful for you helping me do the dishes. The dishes look so great. There's nobody better at this than you. Wow, I really appreciate it when you kept your calm when you were frustrated. I know you had a bad day. Thank you for not yelling at me about it. I know you're frustrated. Thank you for not losing your temper. Look for ways to praise and encourage him every single time in school, in his work, in his chores, in his daily life. Now, when it comes to consequences, create consequences with him when he has a meltdown or outburst and talk to him about it. Talk about the choices he might have made. Remind him that there are consequences to every choice. There are consequences to every action in life, not just for him, but for everybody, including you. Remind him that when you make a poor choice, there's a consequence. Let him know that there are consequences to the choices he made and talk about those consequences. Remind him that he's cared for and you still like him, yet his behavior is not one that will be acceptable in the home. It's also not a behavior that will be acceptable in society as well. Quite likely, you will recognize when he's becoming angry. You'll see those signs. When you see that she's beginning to become upset, help her understand this. Help her recognize this. Suggest some ways for her to resolve the problem. Hugs, encouragement, or removing her from the environment can help. Removing her from the environment might be something as simple as taking her from one room and asking her to go to another room with you, or go outside, go for a walk, maybe spending some time in her room as she calms down, maybe listening to some music. Help her come up with some ways to remain calm and figure out how to handle the problem before it becomes even more so. Now, when she's able to do so, after she's calmed down, after the anger is de escalated, help her to communicate her feelings to you. Help her come up with some solutions to help her calm down and de escalate her anger. For some, it might be playing sports or going for a walk or playing basketball. For some, it might be listening to music or playing music. For some, it might be spending a few moments or even more in a bedroom. For some, it might be talking. For some, it might be cooking. Ask her how she thinks she can solve her problem. Now, just as we talked about in encouraging good behavior, it's also important that you can reward good behavior. To be sure, teenagers in foster care need constant encouragement from you. Consistently praise him in all areas of his life, every single area of his life, and let him know that you understand how hard it might be to make good choices. So catch him in the act of being honest. Reward him for this. Reward him for his good behavior. Reward him for his honesty. Power of forgiveness is so strong for everybody involved. If you feel that he has learned from his mistakes, he needs your forgiveness. Even if he's called you every single name in the book, even if he has yelled at you until he has no voice left, even if your ears are blistering from his anger, it's so important that you forgive him. There's a good chance that he may have never had a parental figure in his life forgive him before. Your forgiveness is so very important. Let me stress that again. Your forgiveness is a gift to him that he may have never had before in his life. Your forgiveness is very important. Now, there may be times when medication might be necessary. Always, always consult a doctor and your supervisor before distributing any kind of medication. And of course, properly document the medication according to your facilities and your home's policy and procedure manual when it comes to medication. Now, when he's having that meltdown, you need to properly document it. And you need to document how it was resolved. In fact, some of the most important words you can use are documentation, documentation, documentation. There's a whole book that you can download here at the Foster Care Institute called the Foster Parent Documentation Book. You'll find this very helpful indeed. And if you're looking for some words of wisdom for working with teens in the foster care system, you might want to check out the book, The Little Book of Foster Care Wisdom. We have several books here at the Foster Care Institute that might be helpful for you as you work with teens in crisis. If you have questions about this, go ahead and email me at drjohndegarmo@gmail.com. You see at the bottom of the slide there. My website has so much more information, drjohndegarmofostercare.com. Webinars, articles, videos, and so much more. Podcasts you might find helpful. And of course, follow me on Facebook and Twitter as well. I want to thank you. I want to thank you for taking time out of your very, very busy schedule to watch this webinar. I want to thank you for all that you do to help teens filled with anxiety, teens who have suffered great trauma, teens who have been neglected and abandoned, teens who have anger problems. I know how difficult and challenging it can be at times, but know this, you're making a difference. You might be the first person who's ever cared for him. You might be his very first positive role model. Keep encouraging him. Thank you for all that you do. For the Foster Care Institute, I'm Dr. John DeGarmo.